All right. I'm about to do a little bit of show and tell. So I've got a box here of things. All right. So back in the day, Gulden made prism bars. Gulden was actually founded in 1938 when the founder of the company invented the first prism bar. That was a long time ago, and this is actually a bar I think that comes from it might be the 60s. I think it's the 60s, isn't it, Sean? Yeah. So as you can see, I'm going to pass this around. If you're an optometry student, you know exactly what this is. But for everybody who isn't, I'll explain. It's a singular piece of plastic that has prisms of different diopter on it. So whenever you're doing an exam as an optometrist, you're going to run that in front of your patient's eye, and then you're going to have to look to the side of the bar to see what diopter that you're on. Now, it sounds silly, it sounds almost too simple, but Gulden asked the question, what if we minimize, this is the most important outcome that we determined, what if we minimize the amount of time it takes to read the diopter number from the prism bar when you're examining a patient? So say I'm the patient. So this is a new Gulden prism bar. Now the diopter numbers are not on the side of the bar, they're in the viewing plane. So now the examiner doesn't have to turn their head to look at the side of the bar and lose sight of their patient. They can keep focused on their patient, and they can see the diopter number in the viewing plane. So it's a very small improvement, but if you think, hey, I'm going to save 10 seconds a patient doing this, and you multiply that for 40 patients a day, and then you multiply it for 365 days a year if you're a workaholic, that adds up. So I'm going to pass around this, which is the new and improved Gulden prism bar. I'm sorry, my wife has an old version. It's so sad. All right. But she'll get over it. I'll get her a custom one. All right, and so the next thing is eye shields. So eye shields are used in kind of emergency medical applications. Say somebody has an injury to their eye. An emergency technician will tape an eye shield over the eye so that it doesn't receive any further injury. So this is a Gulden eye shield. It's a nice little clear plastic doodad, and it's pretty good. There's nothing wrong with it. But the problem is, what if you're looking for that clear shield in a medical kit, in an emergency kit, where every other thing in the kit is white, and you're looking for a clear shield, and you need it immediately, and your patient's eye is bleeding. You're probably going to want something that's orange that you can see better. But how did we get from there to here? We said, what if we could minimize the amount of time that emergency personnel spend looking for the shield? And out of that outcome comes an orange-colored shield. This stands out in an emergency kit. You get something like this, you can pass them around, and actually I don't even need these back. You can just keep them if you want to. Yeah, I got a lot of them. I just brought a whole bunch. It also has instructions on it too. And the instructions are to eliminate confusion. So whenever the emergency technician is putting the shield on, they know exactly how it's supposed to be used. We sell this to the military for their emergency kits for different, yeah.
So the color change is the only difference between the two?
And the instructions printed on it.
Okay.
So yeah.
And that's a whole different device?
Yeah, and that's an outcome that I didn't even list. I mean, that's to minimize, the likelihood of using the device in the improper way. So that would be the outcome that generated the text on it. Yeah.
Basically, we do sell them to the military. And one of the concerns was if stuff happens out in the field and the med's not there, and the guy's trying to help one of his wounded guys, a lot of times people were taking gauze pads. When you're bleeding, the first thing you do is you put something on the wound. For the eye, that's no good. The problem was a lot of times, by the time they get back, their eye's ruined because somebody stuck gauze under there, put the shield over top. So working with a couple people in the VA and through a couple of contacts we have, we decided to come up with these instructions to help save people's eyes instead of ruin them.
That would be the design revision feedback loop. So when you have your initial prototype and you're going to your end user and you're saying, so here's what we've got, what should we change? That's when it's okay to ask the customer. But for your initial prototype, you're going to want to use outcome-driven design to get something that's going to address those salient outcomes. And this is the last thing that I'm going to pass around. It's pretty fun. It's actually one of my favorite products that Gulden makes, and I don't think a lot of people have it. But it's the combo eye occluder. Optometrists use a lot of different little occluders and lenses and doodads. So oftentimes they get lost or misplaced or thrown around in drawers, or just nobody knows where they are or anything. So we said, what if we could minimize the amount of time that optometrists take looking for commonly used equipment? So, the design that came out of that outcome was, well, let's just put it all in one. Let's make a device that has a red lens, a Maddox lens, pinholes of one size, pinholes of another size, fixation targets of different sizes. So that's the combo eye occluder. You can pass that around. All right, so those are 3 examples from our world. And they're simple examples, but you get the point.